This is the Cyprus News Digest with Rosie Haralambous.
On this week's programme, we discuss developments in the Middle East.
The public mood, or the general mood in the international community has shifted very much in favour of the Palestinians in view of the suffering in Gaza.
A call by the Cyprus Integrity Forum for more oversight of our national health system.
And we should stop any way that people or doctors or clerks in the hospitals or whatever get money to offer certain help to people.
And we hear about an upcoming festival in Nicosia Old Town.
This year we're going to have 5 different cuisines. We'll definitely have Syrian, Palestinian, Cameroonian, Iranian cuisines, and we usually have Somali cuisine as well because it's always very well received.
My first guest on this week's programme is Professor of Political Science and History at the University of Nicosia. He is Hubert Faustmann. Hubert, many thanks for joining me. I asked you to come along on the programme to discuss the developments in the Middle East, and let's start, shall we please, with the significance of the prosecutor at the International Criminal Court earlier this week saying that Benjamin Netanyahu and his defence minister and 3 Hamas leaders should be prosecuted. What is this going to mean?
Well, it would mean, if the prosecution is actually really conducted, that any member state would be obliged to arrest those people and hand them over to the court, which of course would cause a huge headache, not just for EU member states, but other states as well that are signatories to that agreement. Yeah, and would make basically Netanyahu and his foreign minister plus the Hamas leaders wanted people globally.
But not in the US, for example, which hasn't signed the relevant requirement, has it?
No, they would not be obliged to hand them over. So far, the US have cooperated with that court. Yeah, but in the US, he would be safe. But within the European Union, Netanyahu wouldn't, or any of the Hamas leaders.
Now, we haven't actually heard much reaction from the signatory states to this. I suppose they're waiting to see whether or not the full criminal court will agree to the prosecutor's suggestion and say, yes, we will prosecute these people. That will make a difference. However, let me also ask you about the news that broke earlier this week that Norway, Ireland and Spain have all announced that they do recognise a Palestinian state. That's going to have a huge knock-on effect, isn't it?
It can, yeah. I mean, the public mood, or the general mood in the international community has shifted very much in favour of the Palestinians in view of the suffering in Gaza and the current stalemated situation. I mean, the likelihood is not very, very small that other states, including EU member states, might follow the example of those 3 countries, and you have a gradual increase of the recognition of the Palestinians without a political settlement that really establishes this state.
Now, you've studied the whole area for many, many years. How do you explain the fact that since the 1940s, there has been a total rejection, if you like, by almost all countries in the world? Until recently, some of them have recognised Palestine, but why is it that the Palestinians seem to be pretty well the only people I can think of in the world who have been denied self-determination and their own state?
Well, first of all, the world is full of people who have been denied their right of self-determination and their own state. So that is not to think of the Kurds, for example, or other minorities that have a record of attempting to separate and setting up their state. So that's a common phenomenon. Yeah, I mean the Palestinian issue is a complicated one because, as you know, historically both the Palestinians and the Israelis were given the right to found their own state, and the Palestinians, together with the Arab world, rejected this because they felt that the Israeli state was built on their territory, went to war. Israel declared independence, was recognized. The Palestinians didn't declare their own state, and therefore the issue of recognition did not pop up. And then in the years after the Oslo Agreement, and with the Palestinians recognizing the state of Israel, there was increasing support. I mean, they have an observer status in the United Nations that is upgraded. There are a lot of countries that actually recognize the Palestinians as a state. Just EU countries are new. So this is a process that has been going on, and is of course accelerated by the current escalation and suffering of the Palestinians in the context of the Hamas-Israeli war after the brutal attacks from last October.
But you did say just now that they had to declare their own state, and yet prior to 1948, if you look at historic Palestine, people had passports saying the state of Palestine, the coins were minted and the stamps and so on all said the state of Palestine. When did it become a non-state when other countries decided that Israel should have some of it?
Well, it wasn't really a state. If you look at it, it was territory administered by the Ottoman Empire. Then the Brits take it over, actually divide the territory in Transjordan and this territory of Palestine, and rule it as a mandate territory of the League of Nations. So it's an oddity in the sense that it's not in a fully fledged sense a state. It's a kind of colony with a different legal status that the Brits are supposed to lead to independence. Yeah, and then the situation deteriorates between the Palestinians and the increasing number of arriving Jewish migrants, and both cause so much trouble for Britain that they quit after the Second World War. And then the idea came up to partition Palestine and create two states, the state of Israel and the Palestinian state, with a very, very different map than the territories inhabited by the Palestinians today. And then, as we said earlier, the Israelis accept, the Palestinians don't, go to war, supported by the Arab world, lose that war. There's ethnic cleansing and fleeing of Palestinians, and the map started changing to their disadvantage ever since.
That sounds familiar to us here in Cyprus, doesn't it? But let's not go down that road. Let me ask you why it is that the international community, which gave Israel somebody else's land, basically, has never determined what the boundaries of that state of Israel is. They've never declared them, have they?
Well, they're different boundaries because they come from different periods. I mean, usually the position of the international community is basically to accept the facts created after the 1967 war, as far as the Palestinian issue is concerned, if I'm not mistaken. Yeah, so we have the West Bank, we have the Gaza Strip. There should be East Jerusalem. That's what the international community still recognizes. It should be part of a Palestinian state. There's no approval for all of Jerusalem being exclusively the Israeli capital. So that understanding is there. But if you look what happened in the last years with the Israeli settlement policy in the West Bank, Gaza is, we don't know what's going to happen now. So the Gaza territories and the borders are relatively clear. The West Bank borders, the discussion is if there's a two-state solution because of the facts created by the Israelis on the ground. There's talk about land swap, so that some uninhabited territories from Israel will be added to the West Bank in exchange for settlements on West Bank territory being given to Israel. But of course, there's no agreement on this. Yeah, but you have an idea about the West Bank borders because they're also part of the Oslo Agreement, and then are divided into different zones of administration between the Palestinians, the Israelis, and mixed zones in those territories. You have Israeli settlement activities that undermine this arrangement. And Gaza, until very recently, you had the withdrawal of any Israeli settlements, and at least the borders of Gaza were clear. Yeah? What's going to happen after the end of this confrontation is a bit unclear.
There's an awful lot of things that are a bit unclear, but let me just ask you one final thing, and that is that on last week's programme I had a lengthy chat to a King's Counsel from the UK who was here on the island talking about possible arbitration as a way to solve the Cyprus problem. And he told me very clearly that international law states that you cannot benefit from military occupation in terms of acquiring land and property. And that's exactly what Israel has done all these years.
And other countries have done. I mean, this is international law, but international law is just one dimension of international politics. We all know that international law has no police force to reinforce it.
So it's pretty
the United
useless.
Nations do sometimes, and in other cases don't, and sometimes it's broken, violated, and renegotiated in the framework of political arrangements. Yeah? So international law might be very clear on this, reality, unfortunately, is rather muddy.
There are an awful lot of things that are muddy. Anyway, Hubert, it's been a pleasure once again having you join me on the programme. Many thanks for your time.
Thanks for the talk.
Keep up to date with events in Cyprus and around the world with the Cyprus News Digest.
The Cyprus Integrity Forum earlier this week called for systematic checks of GESY. That, of course, is our national health system. They say it's needed to avoid corruption and ensure full transparency in the health system. Joining us to discuss the issue from the board of the Cyprus Integrity Forum is Dr. Stelios Hadjikristofi. Stelios, many thanks for your time. What are the main concerns of the forum when it comes to oversight of GESY?
Look, for many years, this Cyprus Integrity Forum, our main concern is transparency and fighting corruption. Obviously, cases within the health system all over the planet, there is corruption. It's the little dirty secret of medicine. Here, we're trying for the past 5-6 years to tell the people that if we don't put proper controls in any kind of system, we're going to have problems.
All right, can I just interrupt you there, because you said it's the dirty little secret of medicine, and I didn't stress at the beginning that you yourself are a medical man, are you not?
I am, yes.
So you know what you're talking about. We'll come back to that later, perhaps, about the dirty secrets. Sorry to interrupt. Do carry on.
Yeah, look, there is an article that we published some time ago about the corruption in medicine. And it was an article that initially was written in India and it was published in British journals about corruption in health. And one of the calls of that article was to calling the doctors to join. We are calling an international campaign against corruption and join your voices with us. And we should stop any way that people or doctors or clerks in the hospitals or wherever get money to offer certain help to people.
Are we talking here about pharmaceutical companies giving incentives for doctors to prescribe their medicines?
You look, that's one of the small problems within the health system. Like you see that, I don't know how much it counts. Obviously, it should. There are more now controls on the pharmaceutical companies, but there are no controls over the doctors or the procedures are happening. And one of our concerns about GESY is that we think that about 50-60% of the MRIs are not necessary, 50% of the blood tests are not necessary, and now we've got a concern that almost 40-50% of the operations are done are not necessary. So we're creating a problem that we've got on one side a lot of specialists, on the other side no controls, and we don't know who is operated for what, who is paying for what. And even though GESY was advertised as one provider and spherical the expenses, it's not. I mean, it's a kind of a mixed medical system that the government is paying for the government hospitals, that there are other businesses like GESY and so on, that they keep money for the health system, that they are paying also part of their expenses. So at the end of the day, it's not clear how exactly GESY is working.
How can we make it clear? What is the suggestion of the Integrity Forum as to how this can be cleaned up so we do all see what is happening where?
Look, as we said, this manifesto we created, which we've got it in English. I don't know if you have it or not, or we can send it to you in English. We've got it in English and in Greek. And what the main thing we're saying there, that we need controls of the whole process, of the whole procedures within GESY. And one of the ways to do that is medical auditing. At Cyprus Integrity Forum, we did a lot of things over the past 6-7 years, but the last 3 years we did quite a few meetings and so on. Among others, we brought the CEO of anti-fraud unit of NHS in England, Alex Rockwell, who gave us a lecture. And among others, he told us that even in England, with all these controls, there is £1.2 billion fraud every year. After that, we read the study from the Electric University of Cyprus, which is they publish a study in 4th of February 2022 that clearly they say there is no control in anything in GESY, in any of the specialities. And among others, they published a lot of things that is not happening. And there is absolutely, they ask a lot of questions how we can improve the system and make it more transparent and fight against corruption.
So how can we do something about this? It seems to me that every time I talk to anybody about this, the biggest problem is referrals from family doctors that actually aren't necessary. Should we start there with cleaning up that and seeing what reasons doctors can give for their referrals?
No, look, the whole system, I believe, is wrong. It's never going to work. We have to think again about the philosophy and about the architecture of this system, and we have to criticize from the beginning. But what we need for the system we've got now is control, and one of the ways to get the control is medical auditing. Medical auditing is something that we can do, and it should make things okay. What is medical auditing? It's a systematic assessment of performance within a healthcare organization. Any element of healthcare can be audited, but most audits look at components of payer reimbursement processes to evaluate compliance with payer guidelines and federal and state regulations. By identifying errors and devising remedial actions to eliminate them, the medical audit serves as vital role in a healthcare organization's compliance plan. And the mechanism for this is to review quality of care provided to patients, educate providers on documentation guidelines, determine if organizations' policies are current and effective, optimize revenue cycle management, ensure appropriate revenue, defend against federal and payer audits, malpractice litigations, and health plan denials. All this, if we manage to do a proper medical auditing, it will help. But the other thing, we have to say that this GESY that we have established in Cyprus, I'm not even sure if we can apply the medical auditing. I'm not sure if the GPs are the proper gatekeepers, as they call them, or not.
I was about to ask you, Stelios, who could do this medical auditing? And you've just, I think, answered that by saying you don't think that there's anybody who can.
Look, we can't, but we have to change things. We have to this thing we should establish with the creation of the general health system, the same way that happens in NHS. They've got a fraud unit that they checks all these things. There is medical auditing, and they check that the operations and any medical practice is cost effective. You cannot give to people things that they don't need because somebody pays. You cannot do things that they are costly but inefficient in certain cases. So yes, we can create the medical auditing, but to create it, we have to change things. So people, they have to sit and check how much money. One of the biggest questions in Cyprus about GESY is how much money do we collect for health in Cyprus? And it's not just what we pay for GESY. Are the people who pay their taxes, and then the taxes pay the government hospitals and the salaries of the doctors and sisters in those hospitals. Then it's all these AIC, CETA, the bank employees that they pay certain fees for health, and some of these fees, they are used but not properly for the health system. Then a lot of people, about 30% in Cyprus, they pay for personal insurances, which also could be, in a way, in a system, get used for the general health system. And then the Ministry of Health that pay a lot of money for people who go overseas. And then some of these patient organizations, that they've got quite a bit of money, they are building their own buildings and so on. So there are so many money coming in for medicine, but they are not used in the proper way.
Does it sound to me like you're suggesting that we need an oversight body that, in a sense, collects all this different money from all these different sources and then allocates it according to need within GESY? The problem with that surely is that if people are paying private medical insurance, that's so that they can go privately and not use GESY, isn't it?
Yes, but look, I don't care if this new system is going to be called mixed system or whatever the case is, or what they are calling it. It should not be controlled from the political parties and all this kind of things. We have to create something that, first of all, is going to survive. Otherwise, GESY will follow the steps. What happened to Cyprus Airways? What happened to Synergatis Mall Bank when it collapsed? What happened to Eurocypria? What happened to Laiki? Certain things, they are not going to survive. So if we want a general health system, is absolute necessity. We have to engage, but we have to get in a way to work for everybody, in a way that is going to survive.
It does seem to me that if we carry on with the wastage that has been very well documented ever since GESY was incorporated, that it can't actually survive for many more years. Would you agree with that?
Yeah, that's exactly what we're saying. And whenever we said that, a lot of people attacked us that we're against GESY and we don't get into GESY. I was one of the people that basically I was fighting for the general health system. But when it was created, I refused to get in because I saw corruption, I saw lack of transparency, and I didn't want to be part of that. I was 25 years overseas. I came back to Cyprus only 10 years ago. So I just didn't want to get involved with that kind of thing.
So what's the answer? We obviously need to do something about it, and I presume that the forum has come up with maybe a 3-point plan or something, have you?
Yeah, no, our suggestion is medical audit, but we have to see how we can put it in the system. And if the system cannot incorporate that kind of thing, then maybe it's time to rethink the system without getting from scratch, without eliminate it. We've got the idea, we've got the way to collect the money, so we have to change a few things. It could be co-payment, it could be other money, it could be all people get to the health system. I mean, one of the most important things when the health system started, it was that the government hospitals will be autonomous. And now that's supposed to happen on the 24th of April, last month.
Well, they keep putting that back every year. They put it back further, don't they?
Yeah, and they will keep doing it. As far as they do this, basically we haven't got the health system that by law decided to have. So this system basically is not what they said. It's not exactly what it is. We just spend money without anybody knowing where this money are going.
Well, quite clearly something needs to be done because it's very worrying that all this money is going we don't know where.
Because here are the political parties that they are running most of the shows. And these political parties are interested about the votes now in the 11th of June. They are interested in a lot of other things. It's the first one we have to tell them that they have to wake up and they have to see in these things seriously if they want to save the health system.
Which, of course, they all say they do, but I'm not sure that their actions follow up their words. We'll watch with interest, Stelios. Many thanks for joining me on this week's programme. That is Dr. Stelios Hadjikrissofi, who is on the board of the Cyprus Integrity Forum, who came out earlier this week calling for systematic checks of our national health system. Many thanks, Stelios.
Pleasure, Chigwell.
This is the Cyprus News Digest with Rosie Haralambous.
The Cyprus Refugee Council is well known on the island, dealing with asylum seekers, refugees and pretty well anyone who needs help when they arrive on the island. And every year they have a festival. Now, bearing in mind that we have a lot of negative publicity about immigration on the island, this is a chance for people to actually get to know some of the refugees, asylum seekers and the people who work with them in a fun environment. To tell us all about it, from the Refugee Council, we welcome Annelies Sparsi. Annelies, how long has this event been running?
It's our 11th annual street festival.
It does get a lot of interest because it's a fun event, as I said, isn't it? I mean, food, dancing, culture, pretty well everything.
Yeah, it is. People always leave with a very positive attitude about it. It brings people together, people from the community, the refugee community, migrant community, as well as Cypriot nationals, locals living in Cyprus. We've got music, we've got other civil society organizations that have their info stands and people get informed about almost every aspect of how one can help or contribute in this field, as well as people meeting people from the community, eating food from different cultures. It's always a very positive vibe, I would say.
Yeah, the food is something I think that a lot of people go there for, because there are lots of, in a sense, home-cooked meals, aren't there? You see lovely ladies from African countries and whatever bringing a totally new vibe to our dietary requirements, in a sense.
Yeah. Every year we try to have a good mixture of cultures, of cuisines. This year we're going to have 5 different cuisines. We'll definitely have Syrian, Palestinian, Cameroonian, Iranian cuisines, and one that hasn't been confirmed yet, as my colleague has told me. But we usually have Somali cuisine as well, because it's always very well received.
Do you also have Cypriot cuisine so that the refugees themselves who attend can get to know our food?
Yeah, well, actually, I don't know if we had that last year, but that is a pretty good idea. It's more for the refugees to promote their food, have some pocket money. It's very cheap because we want everyone to afford it. It's more for the refugee community to promote their own cuisine. But actually, it's not a bad idea what you just said there.
Okay, well, what about the music, the dance and so on? It must take quite a lot of effort to reach out to all these different communities and, let's say, ask them, what can you offer?
Well, from the music, we always have a DJ who plays world music. They do their extensive research to have a diversity of music. This year we're going to have DJ Emilio. I guess you just have to come and see. But it's always really fun, especially once it gets a bit darker, up until 11 p.m. There's people dancing. There's a dance floor, I would say, or just in the middle of the Panero Mini Square. People don't stop dancing for like 3 hours. It's really fun.
It does go on, I think, until 10 p.m. this year?
But let's say 10 p.m. Until everyone leaves and disperses. It might go a bit later. Sometimes people don't want to leave or want the music and the party to go on. But it's up until 10 p.m.
So that is coming up on Friday, the 14th of June, from 6 in the evening till 10 p.m, or maybe a little bit later. It does, as you say, often overrun because everybody's having such fun. And we call it a street festival. It's actually a party, isn't it?
Festival is a good word for it as well. But it is a party, yes. And let's say 10 p.m. I don't want to put anyone in trouble.
So you also have, apart from the food and the dancing and the music, arts and crafts and info stands. Now, I think those are largely manned by other NGOs that are dealing with this field. Can you tell me a bit more about those?
We'll have approximately 20 participating organizations, including civil society organizations and refugee-led organizations and initiatives. They will have their own info stands there, so people can speak with the representatives of these NGOs, get an idea of what they do and how they're involved in this field. So it will be a great opportunity for people to speak with representatives of these NGOs, get a good idea of how they're involved in the field, maybe even have the opportunity to sign up for volunteering, especially with the summer coming up. Usually students are very much interested in how they can offer their time and effort in this field.
Yeah, and as a volunteer myself with an NGO, I know that summer's a difficult time because so many people disappear on holiday. Volunteers can be in short supply. So it's a party for people who want to find out more about other cultures and welcome refugees and asylum seekers, and possibly volunteer at the info stands to some of the NGOs that will be there, and check out those fantastic arts and crafts. I know in the past past there have been things like basket weaving and all sorts of things. So make sure you go along on Friday the 14th of June between 6 p.m. and 10 p.m. to Faneromeni Square in Nicosia to join the Cyprus Refugee Council's celebration of their annual street festival. Annelise, many thanks for joining me.
Thank you. Thank you so much.
Well, that about wraps up this edition of the Cyprus News Digest. Many thanks for your company. Hope you'll join me next week. Till we meet again, take care and God bless. Bye-bye now.